Welcome to our final day of podcast viewer comments. Yesterday, we started our look at whether viewers agree that dentists should stop discounting or disagree. We'll look at more comments when we return. Before we get into today's comments, I think you've seen that I'm willing to show comments from viewers that disagree with me. But in the case of discounted dental fees, I don't think that was an issue. Like this one from Philip Christie, dentist, periodontist, and author in Wellness and Prevention. He said, quote, "Value is determined by the fee. Reducing the fee hails loudly the lack of value. Dentistry continues to devalue itself as it panders to commercialism. My advice is to revalue yourself and the work you do. Increasing the fee is the way to do this." End quote. Now, I love that outlook. That's not to say that I agree that increasing the fee is a way to show value, because you don't want to price yourself out of the market. But if you give it away for free, then that's all it's worth. Another comment comes from Lydia Katrova, a professor of dental medicine. She said, quote, "Thank you, Colin. It's a brilliant explanation of how to consider ourselves on the market. We're not selling crowns and bridges, but we assist people to solve their problem. The prerequisite of a successful deal is the awareness of value in the product. We negotiate plans of treatment rather than price of items. Thank you again, because you helped me a lot in my teaching lecturing activities as well as in my dental office. Value versus price. Congrats." End quote. Well said, and you're very welcome, Lydia. This is what we do. Finally, I'll leave you with a comment from John McNabb, managing partner at Continental Management Consultants. He said in part, quote, "I agree wholeheartedly with Colin on the issue of discounted pricing. It's a slippery slope to a fool's paradise and temporarily increased volume and permanently reduced profitability. Long-term reduced profitability permanently impairs your ability to pay competitive wages of staff, keep your equipment up to date, and to modernize your dental office, undertake marketing campaigns, etc. Regulatory compliance is an additional issue that may also be very important concerning discounted pricing. For example, in Ontario, Canada, the largest Canadian province with over 9,000 dentists, regulations specifically prohibit advertising a fee that is not available to all patients. This is a gray area, and sometimes it's difficult to know where you stand. Discussing reduced pricing with one patient doesn't qualify as advertising, but advertising a discounted price for persons with insurance coverage, a common practice, would contravene the regulation because it sets a lower price for the group, but not for all the patients in general. Broad-based price discounting will become entrenched, and once you've established a reputation in the market as the low-cost provider, you won't be able to implement price increases to restore the financial health of your office without losing a significant portion of your patient base. And that's exactly the point I'm talking about. Plus, that provides some great supplemental information about our friends from the North. Keep the comments coming. I love the feedback. You can comment below on YouTube, comment below on LinkedIn. I read them all. They're also on Facebook. They're on Twitter. Tweet me, email me, Colin at smartboxwebmarketing.com. Come back tomorrow. I want to give you some tips on how to kickstart your creativity. Until then, keep moving forward.